Thank you, Madam President. Members, this is a bill to try to remedy a problem that has been plaguing the country and the state for longer than any of us, I'm sure, would like to admit. We have in this state arguably 6.5 million people who are uninsured. But those who are insured oftentimes can't keep that insurance because of the disproportionate rise in costs, not only associated with their plans, but with pharmaceuticals and other medical appliances. So this is an effort, one of a number of efforts that are moving forward right now, both in this House and in the Assembly, to do something about that. We could spend a lot of time arguing about whether or not the federal government should do this or we should do it. We had that argument yesterday. This, I think, is a little bit more clearly the responsibility of the state of California, the legislature, and the governor. Last year, we were able to work together fairly well to accomplish some significant things, some of which were controversial. This is certainly, like most things, complicated. If it was easy, it would have been done by now, and lots of people would be taking credit for it. This is very complicated, and in fact, the governor, who has led off this by talking about his plan, his bill, he does not yet have a bill, and I think that is due in part because there are so many moving parts in this. However, it will not get any better unless we jump in the pool and get wet. So this bill is, and a lot of work has gone into this bill, and there are numbers in here that some people believe are not only off-putting but staggering. There is no doubt that we are not going to be able to accomplish what needs to be accomplished unless we do something about it. Now, there are a couple of principles here. There is an individual mandate. Nobody rides for free, both employers and employees. We can debate the 7.5%. However, that is not a number that I came up with, as capable I am with my math skills to do that. This came out of MIT. It came out of one of those big mother computers. So for me, I have to take some faith that those people who know the business, who are medical economists, which they certainly didn't have when I was going to college, these are the people who provide us with the information. We are generally in agreement that that is the number. I believe that's the number the governor's using, that's the number the speaker's using, and so in those of us who have a mandate, that's what it does. There will be particular attention paid to cost containment and guaranteed issue. Cost containment affects everybody who has medical insurance and hopes never to have it canceled. By the way, we now see, and I'm sure you do too in your own constituency, where people are afraid to use their health plan, just like nobody wants to get into a car accident and call their insurance agent, as friendly as they are, because they don't want their premiums to go up. That's beginning to happen. But the difference is, if you want to have a crinkled fender and drive around with it, that's okay. But if there's something wrong with you and you avoid going to the doctor or you avoid a procedure because you're afraid you might get your ticket punched, that's not okay. That'll get worse and it'll get more expensive. But there's that psychology creeping in because people are very desperately concerned, rightfully so. Those of us who are here who are generally insured by the state of California, we have seen through CalPERS a dramatic increase in the cost of health care insurance. We heard recently that Blue Shield is now no longer going to take enrollment from some of the foothill counties because of the higher costs, apparently, to provide service. I don't know whether that's true or not. All I do know is that we are now seeing eliminations occurring, less competition. When I first signed up with the state years and years ago, I had a plethora of opportunities. Now you've got Kaiser, one of the Blues, or both of the Blues, and one of the Blues. And then you can have an HMO or PPO. So this is as much about people who have insurance and are trying to keep it as it is about those who are not insured. I do believe, however, that the governor's idea that we should be covering everyone because one way or the other, as the Fram oil filter commercial used to say, pay me now, pay me later. So that is an important consideration as well. I don't want any of us to lose sight of the fact that unless we are able to solve the riddle of how to make sure people who have insurance continue to have it and have it when it's affordable, not at a discount, we have to accept it for what it is. But when medical costs are going up 5, 6, 7 times the rate of inflation, there is something fundamentally wrong. I know doctors are not getting rich off of this system. I know nurses aren't getting rich. EMS technicians are not getting rich. I mean, there is something in the system that is causing this to go. I also stipulate out of hand that the older we get, the more we would like to stay fit, stay healthy. So we may want to ration health care except for us. If you want to have a hip replacement when you're 90, we may all argue, well, that's a waste of money. Well, either you can bequeath it to your family, the hip, or we can stand up and say, no, you don't get to have that. Now, those are tough questions. Those aren't even ethical questions. They're practical, political, and economic questions. But long before we can get to that, we have to restore some sense of rationality and confidence in this system. So this bill is been shaped. It's going to continue to be shaped. It will ultimately, I'm sure, be subject to some kind of a conference committee. I know Republicans have introduced bills that I don't think are necessarily exclusive of this, and I didn't, so again, I think we're better off trying to do this together than not. In the final analysis, unless we attempt to do something in this area, we're going to forfeit the responsibility to the federal government. And there's just no inclination right now, particularly with the actions taken so far in Washington on coverage. There's no guarantee that they're going to do it. So if California can provide the leadership here, as we have recently in some other areas, if we could demonstrate a willingness to look at the tough questions and try to resolve them, we will at least have served the immediate interests of our constituents, which after all is the reason we were elected. I would ask for an aye vote.